Hey everyone, welcome back. This is Troy with Advanced Spine, Joint, and Wellness in Medina. We took a little break in our podcasting and our little community broadcasts over COVID, and back today to kind of get started and back to our live feeds and just put some great information out. So hey, if you're looking for us, you can find us online. Go to ohiopain.com, so you can find us online there. That's our website. Great information on the website. Instagram, you can find us. It's advanced_spine, so you can find us there. And you can also just look us up on Facebook or YouTube. So today what we're going to do is kind of get back to some of the basics. One of the most common problems we see in our practice, and of course I would say in the community, is sciatica. So what I really wanted to talk about today is just some of the causes of sciatica, and also just kind of discuss what makes it so hard to treat. Oftentimes when we're seeing patients here, many patients have just tried and failed other conservative things, meaning like chiropractics or physical therapy. Maybe they've tried some home-based stretching. So I just kind of wanted to go through some of the common diagnosis of sciatica and some of the treatments that are available, and then again, what makes it so hard to treat. So first, let's just talk about the sciatic nerve itself. It is the largest nerve in the body. I've got a few models, and hopefully you guys can see this on Facebook Live, but I've got a few models, and I just want to talk about the anatomy of the sciatic nerve, because if we know the anatomy well, it kind of gives us a clue as to where the problem's coming from, because there are 5 potential sources of sciatica. And if we as providers don't do a good job of really identifying the source of the problem for you, the individual, as you come into us, oftentimes our treatment might fail because we're treating the wrong potential problem. Too often, and we're guilty of this too, it does happen at times, but too often providers rely on just simply an image, like an X-ray or an MRI, to establish the diagnosis. And that'll look at the structure, but oftentimes it ignores some of the soft tissues that are often a problem with the sciatic nerve as well. So let's talk about where it comes from. So the sciatic nerve, if you look here, I've got a spine in my hand. This is about life size. And the sciatic nerve is basically, it's made up of 3 different nerves. They're right down here in the spine. So it's number 5, number 4, and number 3. And they come from the spine at these disc levels. And this is our first potential source of issue, is that there are a handful of problems that can occur at the disc level to pinch the nerve. And that typically is what is causing sciatica, is we've got pressure on a nerve somewhere. So the things that can occur at the disc level, number 1, we could get a herniation. A herniation is usually an acute injury, meaning that you're lifting something or you've fallen, twist and turn, and you feel like something kind of snap or pop in the spine, and we can pop a disc kind of like squeezing a jelly donut, and the disc can slide out of place and it can then put pressure on a nerve. So a disc herniation is one potential source. Disc degeneration is another source, and I think this one goes unspoken too much with patients. And I've brought a degenerative disc in here because I think this is one that really needs to be talked about, because the word spinal stenosis comes along with disc degeneration. And if we look at a degenerative disc as compared to a regular disc, so here's a normal disc, and what we can see is the disc has a nice space between these 2 bones. It's a spacer. That's really all it is, and it's a shock absorber. So it's absorbing shock for us as we walk and move, and that's what it does. But one of the other functions that it has is we have a full disc that keeps this little tunnel open here for this nerve to come out. Now you can see that this tunnel was built, God was pretty smart, he built this tunnel kind of oversized. So this oversized tunnel allows this nerve to come out. The problem with a degenerative disc is that, as you can see here, our disc space got smaller. So as this disc space gets smaller than this one, what also then happens is our tunnels will also get smaller. So you can see here, big tunnel and a small nerve. Now we have a smaller tunnel, and there's our nerve, and that smaller tunnel can eventually begin getting to the point to where it squeezes the nerve. And that's spinal stenosis on the outside. That can also occur on the inside. Spinal stenosis is a very common source of sciatica. And if you do some really good research, we posted this up on our website and Facebook not too long ago, 90% of the time you can manage spinal stenosis without surgery. So if we look at our potential sources, source number 1 is just at the disc level with disc herniations, potential disc degeneration, or spinal stenosis. Those are some of our most common things that can occur here. Now another potential source, in 25% of the time, this joint here on the side is part of our problem, and that's called the SI joint. Now, I think the SI joint is one that commonly goes overlooked. We see that a lot where a lot of patients have come in, maybe they're post-microdiscectomy, they've had some surgery, maybe a laminectomy, and that didn't seem to resolve things, that a lot of the problem can be around the SI joint. So as the nerve is leaving these little tunnels, it creates a bundle and it goes right by this joint. And if just joint is dysfunctional, sometimes that can be the source of the potential problem. So we really need to take a good look at the SI joint. And then the nerve kind of comes through this little dish right here and goes through this little notch right in here. And I don't know if you can see this notch, but it has to come around the corner here in this notch. And then it goes through a muscle called the piriformis. And this is another potential source. This is a really common one that people get when they're driving, when they're sitting for long periods of time, is we're putting tension on the nerve as it goes through a muscle. So that's another potential source of sciatica. And another one that really goes misdiagnosed a lot, and we've missed this on a handful of occasions too, is that the nerve travels right behind the hip joint. So the hip joint is here, and the nerve travels right behind it. And if the hip joint has arthritis in it, if you're older than 45 and potentially have hip arthritis, oftentimes the arthritis in the hip joint, that inflammation irritates the nerve as it goes by, and that can be the source of the sciatica as well. So we as providers really have to think our way through, not just with images, but also with our physical exam to really identify where is this potential problem coming from. So that's kind of step number one. Do images help? Absolutely. I don't want to discount that. A good weight-bearing x-ray is dynamite to really look at some potential problems with motion. In MRI, I think the biggest thing that a lot of patients don't understand is an MRI is non-weight-bearing. So there are some things that really change when we weight bear. So there's limitations to the MRI, but it is valuable, and looking through the hip joint as well. So that's kind of first thing is we really have to establish where is the pressure on the nerve, and those are our potential sources. So with those as our potential sources, some of the common symptoms that we see. Sciatica doesn't always fit just kind of this radiating leg pain going all the way down to the foot. That's the most common symptom. Pain that shoots, from the butt or the back all the way down the leg. Yeah, that is the most common problem that we'll see. But sometimes sciatica doesn't radiate that far. Maybe back pain that radiates into the glute, or it's very common that it'll refer around to the front of the thigh or even into the groin. So that's really common. And those are the most common symptoms that we see, and it tends to be worse with sitting for long periods of time and or even standing or walking for long periods of time. And if it's not treated early, the problem is that the dysfunction tends to get worse. So if you have sciatica and you really haven't done anything for it for a month or 6 weeks, and it seems to be getting worse, get in to see a doctor, because early treatment oftentimes means that we're going to be more successful. The more that we delay treatment, oftentimes other structures become dysfunctional. So those are some of the common causes, common symptoms. Now let's talk about why is it so difficult to treat. So the difficulty in treating sciatica, if we look at, again, all the potential sources of where the nerve is going, it's a pretty complex nerve from the time it leaves the spine until it gets down to the hip level here. So if you think about the spine, it's like a series of gears. As that nerve goes by these structures, if one gear becomes dysfunctional, like in a watch, it's going to affect the other gears that it works with. And that's the way sciatica is too. And oftentimes, when it's been there for a long time, a year, 2 years, 5 years, we've seen patients walk in with pain for up to as much as 20 to 30 years. So what that means is we're going to start to see other structures become dysfunctional. And let me give you this kind of analogy, is that if a car has bad alignment and you keep driving it, yeah, you can drive a car like that for a long period of time. But if we keep going, we might start to damage a tire, maybe a wheel bearing, and then if we keep going, a ball joint. If we keep going, many other problems can begin to occur too. And our body's the same way. And that's why sciatica gets to be more difficult to treat. We have a bundle of muscles around this whole structure. We have many movable joints through the lower back and in through the pelvis, and that's what really complicates the treatment. Now, if you're out there and you're struggling with it and you've tried things in isolation, oftentimes what goes overlooked is that we really need to consider kind of working with it in what's called an integrative fashion. Sciatica can be really hard to treat if we only work on joints, and we have chiropractors here, and if our chiropractors are the only ones working on it, they're working on the joints, but oftentimes they're not working with the muscles as much. We do have massage therapists and physical therapists here as well, and oftentimes they might be working on the muscles, trying to loosen muscles or just create some motion, but we might be ignoring some of the underlying alignment that chiropractors look at. So when we look at it from an integrated approach, we're trying to make sure that we address each area of dysfunction. And I think therein lies the difficulty of treating sciatica, is we don't necessarily just want a one-sided approach to it. We do also have orthopedic surgeons that come on site from St. Vincent's, and oftentimes we might use a tool like an epidural steroid injection to get things loosened up, some massage therapists to get muscles loosened so we can better move joints and remove pressure off. And that's what makes the problem so hard to treat, is we just got to look at every structure that's now become dysfunctional. So sciatica, if you're dealing with it, you can reach out to us, reach out to your family doctor. There are medications. Sometimes we're not anti-medicine. There are some medicines that can calm this down if it's acute as well. Reach out to someone. Don't let it go any longer than 4 to 6 weeks. Thanks for paying attention today. Nice and brief today. Next week, we'll talk a little bit more about degenerative discs. Degenerative discs with sciatica are the most common problem that walk into this office daily. And we'll talk about that extensively next week. Now, again, if you want to find us, you can go to ohiopain.com. You'll find tons of information on our website. You can go to Instagram. You'll find us at advanced_spine, and on our Facebook page. Our Facebook marker, or our Facebook poster, I don't know, what do you want to call MJ? So MJ is back with us. She came off of maternity leave, and she's putting up some great information with Facebook and Instagram again. So follow there, hop over to YouTube, subscribe. You'll get some of the great information there as well. And then we'll see you next week.